Yes. Hello, 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 everyone. Thank you guys for bearing with us. We had some technical difficulties, but like I said, none of that is going to stop the show. The show must go on. Yes, welcome and thank you guys for jumping on. I'm Dr. Tamara Beckford with Your Caring Docs, and we are here to help all our busy professional women put their health and wellness first for at least 2 hours a month. That's right, 2 hours a month. It says that we might be having some issues with our Facebook people. So hopefully, Facebook, you guys are here and we're going live and in charge, right? So today, we have a wonderful guest. This is one of my sisters, and I am going to be sharing her with you. That's right, because I am that generous, right? Let me bring her in our Your Caring Docs fashion, right? So, this doctor is a graduate from the University of Medicine and Dentistry, New Jersey Medical School, NJMS, that's right, also known as Rutgers, New Jersey Medical School now. That's right. Then she did her family medicine residency at Albert Einstein College of Medicine. All right, all my Albert Einstein people, family medicine. But because she is such an awesome doc, she didn't stop there. She went ahead and she did a fellowship in women's health and surgical obstetrics. That's right. She was out there delivering babies and doing a lot of obstetrical work. That's how our sister doc is. She is that good, right? But then, as I said, with most of my docs, she didn't stop there. She went ahead and she also got certified as an HIV specialist by the American Academy of HIV Medicine. She is the CEO and founder of Livingspring Family Medical Center in Mansfield, Texas. Welcome, 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 everyone. Dr. Olabintan. Where is my speaker? Dr. Olabintan, thank you so much for stopping by. You're so accomplished. I mean, you are doing it. And by the way, all of you guys out there, how many of you know a lot of people who started med school at the age of 20? I do. This chick right here, she is that good. She is a superstar out there, and I am sharing her with you guys. Welcome, welcome, Dr. Olabintan. How are you?
I am good. Thank you so much, Tamara. And man, you do know how to make someone feel welcome. Thank you. I'm
No,
honored to
because
be
you're a star. They need to know. A lot of people don't know how you're doing it. Yes, see someone is like, yes, giving you the high five on the
here. Thank
Facebook.
you.
Yes, welcome. So, I want to know what brought you here? What brought you into medicine? How did you develop that love for medicine? Tell us where it started.
Honestly, it started as a young child. I would say 7, 8. I always like taking care of people. It seemed like a natural fit.
Mm-hmm.
And then I would see the nurses in their cute little white uniforms and had the little hats. And I thought I wanted to be a nurse. And then I
Mm-hmm.
saw a doctor. I would watch doctors, and I would see that they would be the ones telling the nurses what to do. And I'm like, you know what? I kind of want to do that.
I'll look at you.
Yeah, so it started with that, and then I had there were several things that kind of sealed the decision to become a doctor. Experiences in life, losing my aunt to asthma in her 20s. Something I
Mm.
thought that I, of course, got to know was something that could have been managed better. So it like over years, there are certain experiences that would seal the desire to become a physician. I like taking care of people, so it's a natural fit.
Yes,
Yes.
yes, you do, and you're very good at it. Now, you saw this in your experience that brought you into medicine, especially seeing your aunt, losing your aunt to something as asthma, especially now knowing how it is. It's
Right.
very, it's something that we can treat, but we still lose a lot of people to it. What brought you to family medicine?
It's so interesting. Before medical school, I thought I'd be a pediatrician. I love kids. They're just fun, and so I of course started my rotation off strategically doing peds, and that's where you of course would do your rotations and get a feel for each residency type or each specialty type for those who are watching and who may not
Mhm.
know. So I chose peds first, and as much as I like kids, when they're sick, they kick and they scream, and it's kind of different from what I pictured, but I still love taking care of kids. It
Mhm.
was towards the end of my 30, I got exposed to family medicine, and I met a doctor. I'll give a shout out to her, Dr. Duncan, Kathy Ann Duncan. And she would see a patient in their like 80s, would see their kids, their grandkids, and then was going to see their great grandkids, so the baby that was just born. And I remember one of the visits I was there, it was an 82-year-old man. He was like, oh, look what I can do. Well, about 88. And he did a push-up. Dr. Duncan had been their doctor for decades. And I was just like, man, this is powerful. I get to influence people in a way that transcends generation for better outcomes. I'm like, this is it. So I was kind of torn, though. I do like OB, delivering babies. So with family medicine, there's a promise of being able to kind of do, kind of a little bit of everything. And I get to be a part of the whole family picture. And so that was really neat for me. Family medicine, yes.
Oh, wonderful, wonderful. And, like you do love women's health, as, stated by the fact that you did a whole fellowship in it. And people, for those who don't understand what a fellowship is, how many additional years of training after you finished residency did you do in order to do this?
So I did that for about a little bit over a year, and it was pretty intense. All I was doing was taking care of high-risk pregnant women, and taking care of the babies, of course, that they would deliver, and learning the art of doing C-sections in a rural area in Tennessee, because there's a big need there. So it seemed appropriate for me to get those skills there. So yeah, a little over a year. Yes.
See, so this is her delivering, taking care of before, during, and after. I told you she's the real deal. She's the real deal. So now women's health, we said it's so important. You even did, like I said, your additional training in that. So today you're going to really highlight to us women who are really busy, and then we forget, like, hey, we need to take care of ourselves. So go ahead and highlight how important it is, and what are some of the preventative measures that you, as our family medicine doctor extraordinaire, have out there for us, and how important it is for us to listen to what you're telling us. Go ahead.
And not to discredit men or anything like that, but as women, we kind of have an influence in how our spouses or significant others and those we care about, the kids, we have an influence in how they see their health or how they manage their health. I have a lot of times where the moms will bring the kids, and then I ask, have you taken care of yourself? Oh yeah, I got to go get to the kids first and encourage my husband, and then I'll come see you. Right. And so there's a big preventive aspect where I'm teaching the parents of the children that come to see me, or the women who come in because they have to, because they're really, really sick, that, putting yourself as a priority on the list is very, very important, because a lot of people are tied to your well-being.
Absolutely.
So it's not being selfish. It doesn't make you a bad mom. It makes you wise. It makes you a wise woman, because you understand that a lot of things are tied. So if you suffer, then a lot of things suffer. So when you don't want that to suffer, it's really important to take care of yourself. When you're going on the plane, they tell you before you help someone with their own mask and the oxygen device, put your own first. So it's learning to include yourself in your planning for everyone else's health. So that's one. I always kind of paint that picture. And then secondly, I kind of paint a picture for my patients, and I say, where do you see yourself in 10 years, 20 years, 30 years? What's important to you? And they say things like, oh, enjoying my grandkids or traveling the world. So there's a desire to live, extended length of life. And so they say, well, how can I help you get to that point in the best shape possible? So, and then I always use the car narrative, even though sometimes for my women patients, it's kind of lost on them. I say, you have something really prized, really important, but you drive a car, would you wait for it to break down before you take it for a checkup? You want to catch things before. And, it's sometimes a tough conversation, because, when I'm having discussions with my patients, I tell them, it's not like we're looking for something to be wrong. Absolutely. Like, I'm not out to get you. We're not out to, let's find that thing that would just make you miserable and you got to test for. No, my lenses are more what based on your family history, what based on your lifestyle, what based on your eating habits, what based on certain lab tests you've had before, certain patterns, what based on that reflects that something is going on and it's better for us to catch it beforehand. And so And the decision is both ours. It's not, I'm not going to force you to do it. I tell you, I suggest based on this, we do this. What do you think?
Mm-hmm.
And so we're looking for something that could potentially cause issues down the line and could affect the quality of life you dream of. Okay.
Mm-hmm.
So that's where the conversation starts. And then we go into, like, we got to check your breasts, make sure they're good. We got to do your
Absolutely.
cervical pap, make sure there's no cervical cancer. We got to do certain blood tests, and discuss them, but
Mm-hmm.
that's generally one aspect of the preventive care.
Mm-hmm.
I also mentioned this. I was asked about depression, and I don't ask. I mean, I'll ask if you're depressed, but I ask how are you doing emotionally? Like
Mm-hmm.
how are you doing emotionally? How do you de-stress? And what's on your mind? What can I help you with? And conversations come forth from that. So I think that's preventive. Um,
Yeah.
yes, yes, yes,
No,
yes.
it's actually very important. I love the way that you bring forth that question. What's on your mind? Because if we really stop and think about it, most of the time we are not thinking about what's going on now. It's just, okay, well, let me hurry up and get this doctor's visit over. Well, first of all, we're just happy that you came. Part
Right,
one, that you came to the doctor. But if we do take a step back, there are a lot of things that's on your mind, a lot of issues that's pressing, and if we don't ask, a lot of times, number one, you might not recognize that this is something going on that's adding additional stressors to
right.
your life. Or number two, you might feel like, I don't want to burden my doctor with this. I'm here to really come and get my blood work. So I'm not going to let my doctor know about my additional fact that I have three family members who are extremely sick, and I
Mhm.
am the breadwinner of the family, and I have to take care of everyone. And, I'm not really sure how things are going on with my job because I had a change in the boss, and the new boss
Right.
is not as receptive. Like, all of these are additional stressors that really weighs in heavily on you. And as your doctors really, especially your family and your primary care doctors, all of that, we recognize it affects you, and
Yes,
it
it does.
affects health. Go ahead, tell them.
Yes, it does. And interestingly enough, sometimes when we have conversations, it's not doctor patient, it's woman woman.
Woman,
It's
absolutely.
like, I know what you're going through. And sometimes hearing somebody else go through that can
Mhm.
actually be like it's almost like oh, so it's not just me, or
Mhm.
it's not my husband, it's maybe a men thing,
It's not
or
just that.
like, oh, people have gone through this and this is how they navigated through that.
Mhm.
Sometimes sharing that experience alone is helpful, but you, woman to woman, we talk
Mhm.
about the stressors of having to change jobs, or what COVID has done, or how it's changed the way our life has, how we live out our lives, or vacation
Mhm.
plans, or virtual learning, and we exchange stories, and, oh, this is what I do, oh, you know what, I'll try that. So sometimes it's not just a
Absolutely.
patient doctor. It's just human to human, and
Yeah.
that I found to be very therapeutic, not just for the patient, but for me as well. Like, both of us get to enjoy just having a dialogue about life as a woman. So yeah.
Absolutely. And that's one of the aspects that I wanted, also to emphasize, is that we're women who happen to be doctors. So this is our profession. This is what we're here to help you. But we're women, so we go
Right.
through the
Mhm.
issues that you, as a woman, as our patient, you'll go through the same thing that we're going through, right? We might have the perspective from that medical perspective to help you, but little
Right.
tips here and there, we have tips to provide for you, and you have tips that you provide to us. So when we're talking woman to woman, it really helps on that level. And I'm pretty sure that it makes your patients a lot more receptive to what you
True.
have to prevent to them. That's okay. Yes, it helps, them to be more receptive to what's going on and to the care that you're provided, because they're like, this doc, she gets it. She understands what I'm going through. Alrighty. So now you've done all of this. We've talked about some of the preventative things. Let's name some preventative measures that our ladies out there should be thinking about right now.
All right. So very important, depending on how old you are. And of course, this is something, the discussion you have with your primary care doctor.
Mm-hmm.
But your breast exams. So
Mm-hmm.
learning how to do them monthly, preferably after your period. Very, very important. Mammogram starting at 40 and sometimes earlier, like I said, depending on your family history. And that's a discussion you'd have with your doctor. But that's very important.
Mm-hmm.
Sometimes, people ask, breast exams, why do I do them? Well, they're yours for starters.
I
So it's
like that. They're yours.
so you should kind of know what normal feels like. What's the baseline? So that's the whole idea. So if there's something abnormal, something out of the ordinary, you may be the first one to notice that.
Absolutely.
I've had patients who, I actually had a friend who lost to cancer. She was one who actually found the lump early. And unfortunately she passed, but she was the one who found the lump. So getting familiar with what your breasts are supposed to feel like normally is very, very important for you to be able to know and differentiate that from when there's something abnormal. And remember, typically it's outside of your period because during your menstrual cycle, your breasts are they're bumpier. That's the best way. Bumpy. Okay, so
Right.
that's one. Two is your pap smears, age 21 and up, doing your pap smears. Why do we do them? And a pap smear is not just my doctor looked at my vagina. It's not just that. It's testing for cervical cancer. So I want you to understand the difference. A pelvic exam is not always a pap smear, but a pap smear is taking a sample from a part of your cervix and sending it off to pathology to see their abnormal cells. And we do all these things because we're in a level of science where we can treat them effectively if caught early. We're not going to go look for something and say, well, you got it.
Right.
That's it. No, we go in, we do the test, we catch it, and we say, hey, you got to do this to prevent this, and this. And so doing the pap smear is very important. Number three, I recommend this to all my women, getting your dental checks, your teeth. Yeah. Some funky bacteria in the mouth. It actually is linked to increased risk of preterm delivery if you're planning to get pregnant. And it's linked to overall unwellness. So getting a dental check and, get that good, clean dental feel, after the cleaning, very, very important.
Absolutely.
And then getting your eyes checked. A lot of people kind of overlook that and say, oh, I can see. The thing about eye exams or the eye changes, they're not overnight. They're subtle. Little changes, so getting your eyes checked are also very, very important. And depending on your age, like I said again, family history, things like getting blood work drawn, checking your cholesterol, screening for diabetes, checking for thyroid disorders. Those are very, very important. And checking kidney function, liver function test. Like I said, this is individualized. You talk with your primary care doctor and they discuss based on risk factors what blood tests to do. Now there's a series of other tests too as you get older, getting your bone density checked. And I sometimes I have patients tell me, well, my bones don't hurt. Why do I need to check my density? This is one of a thin bone or low bone density is one of the biggest causes of fractures. So arthritis is between two joints, the cushioning is reduced. Osteoporosis or thin bones is the density, how thick the bone is. So almost like it's starting to become almost see-through. So it gets thinner. And so a small fall or a minor bump or a minor injury can lead to a big fracture, which leads to hospitalization, which can lead to blood clots, which then leads to other sequelae down the line. And that's where, the prevention, catching it before it becomes a problem, is very, very, is very important. But those are some of them.
At what age do they start looking for this bone density? Because we're kind of creeping up and we're getting a little bit more wiser, as I usually say. The numbers are adding up, so
Oh, so it varies. So if there's a family history of osteoporosis, if you're on chronic steroids, someone who's been on steroids for a while can make the bones pretty brittle. So you might want to do that earlier. And insurances sometimes dictate when that's done, typically age 60, sometimes earlier if you've had an unexplained fracture or a fracture for a benign cause, then doing it earlier is actually indicated. And of course, it's a one-on-one with your doctor to kind of discuss. And that's why we ask questions. Have you had a fracture before? And then I ask, what happened? Oh, I fell from a tree. Well, yeah, that's a long impact.
Well, yeah,
Well, I the door slammed my hand. Well, slammed it really hard. The bones in the hands are smaller, so yes. But someone bumped me. Oh, I don't remember what happened. I just had a fracture.
Then
Then
it leads us to think.
That's something that's going on.
All right. Well, there we go. So now here are some of the things that I love that we said that, based on the age, and that's the thing about like with the women, you have the varying age and there are different screening factors. That's important, right? We're starting at age 21. Cervical cancer screening starts around that time. And then, of course, you still have the risk factors that you're looking for, family history of high blood pressure, diabetes, cholesterol, all of those screenings, right? You're doing the breast exam, ensuring that you're not doing it during the time when you're having your menstrual period, because the changes in the breast tissue and the density, it changes during that period of time during your period. And so you're doing it afterwards, right? So that you're ensuring that you can know your breast. Why? They're yours. They're yours. They're with you. So it's a great way for you to keep that in mind. And then we know that, at this recording, we're in October, which is it's Breast Cancer Awareness Month. And there are a lot of women who they are the one who notice the lump first, right? I've had family members, and I'm glad that my family member, she's a survivor. Shout out to my cousin Indija. Right. She has survived, and she was able to find hers first. We also have a lot of our people within our community, our Your Caring Doctor community. We have a lot of survivors there. Dr. Dakota, her story was just recorded and, dropped. So we know that we have a lot of women who are survivors, those who found the lump themselves, those who went for their screening and found it, right? And that's why the screening is so important, finding it very early so that you can have a great outcome, or the best outcome, which is to be able to survive this thing. And then as you get a little older, or if your circumstances are different, right? If you're on steroids for a long period of time, your bone can become thinner. As you get older, your bone becomes thinner, and therefore the bone density test is important. Why? Bone is thin means that it breaks easily. Bone break, you're placed in the hospital. And then we said that there are countless other things. If you're in the hospital on bed rest for a long period of time, or even the fact that you had a fracture, or which is a break of the bone, increases your risk for blood clots, right? So all of this can go on. And we're not even talking about the fact that this is happening to you, and you might be the breadwinner of your family, or you might also be the person, whether the glue that holds everyone else together, and you are now taken out of the direct care of helping others, and you having to care for yourself. And there are a lot of other issues and additional stressors that occurs, right? So some of these can be ways to help to prevent that by taking care of you first. All right. So now that we've pulled all of this from Dr. Olabintan, we want to know, what is Dr. Olabintan doing for herself to reduce her stress, right? What is her go-to? You let us know.
Way to put me on the spot. Like, what do you do? Practice free. All right. So I'll be honest with you. It kind of took COVID for me to do a better job at that. Because one of the things I was catching myself doing is getting to a place where I was not happy, and I was using food as comfort. Now, and I realized, I had to take care of, I had to take care of myself, and I had to practice what I preach. And why that was a big deal is over time, I started to feel more sluggish. I put on a few pounds, but I didn't mind that, but I was feeling very tired and draggy, and I knew I had to change that. So one of the things COVID had taken, I'll be honest with you, for someone like me, was the ability to hug. I didn't realize how much of a hugger I am. All my patients, of course, I didn't want to make them uncomfortable. And of course, we're practicing the discipline of reducing the risk. So I couldn't hug a good number of most of my patients. Some needed the hug. So, yeah. So I started learning, okay, what can I do? So, I would, talk to my family members, my husband, talk to my daughter. She's a hugger too. And we would just,
Yes.
so that was one. And then I started looking for other things outside of food that I enjoy and as a way to self-soothe. I tell my patients this, it's like hugging yourself. Reading a book. I enjoy reading a book, not necessarily medical. And so I'll do that in the evenings sometimes. I enjoy listening to music. I enjoy singing. I enjoy dancing. So my kids, my husband, we know I come home sometimes, put on the speakers real loud, and we just duking it out. That's it. And
You have a dance party.
it's as loud as speakers are, and it's just energy, and we're dancing and we're laughing at each other's moves, and everyone's put on the spot like, okay, your turn, bust a move, and everyone's supposed to do it. So we do that couple times a week, and that was good. And just being open to and having conversations about how I'm feeling and the need to rest. Need to rest, turn off my phone, do not disturb sometimes, and just being, just being.
Yes. Just being, that's important. And I think that that's something that gets lost in this hustle, especially with us being very busy women, right? Sometimes just being for a moment in time is enough to recenter us and to have our cups refill in order for us to give out to others. All
Right.
righty, well, there we go. We found out all of that about what you do for your stress release. Now, what we want to know is, if you weren't a doctor, what would you be?
Ooh, that's interesting. So, I was debating at one point. I like being an architect. Sorry, architect. I love the drawings, but one of the things that required, you got to do it to a T, otherwise the angles are off. So I was like, man, nah. But that was no, but it was a close third. But I love math. I math. You see, math is straightforward. 1 + 1 is always 2. It's not maybe. It's not possibly if you explain this way, or if you no 1 + 1 is 2.
I
It's
love
I
it.
love math. I took Calc 3 just for fun, but one of the things I love
Okay. Hold
math
up.
for fun.
You
I
took
didn't need it.
calculus 3 for
Just
fun.
for fun. Yeah, math is just
I love
So
it.
it was either that or be a math teacher. So it was be either doctor or be a math teacher. Yes.
Okay, well, we love it. We love the fact that you took calculus 3 for fun. We're going to hold that. Yes, hold you to that. The fact that you love math that much. You're like, let me continue on. Wow, wow, wow. Love it, love it, love it. All righty, Dr. Olabintan, you have provided us with a wealth of information. And I'm pretty sure a lot of people who are listening are like, where is this doc? I need her. She is so well learned. She's family medicine. She did additional training in women's health and obstetrics. She was delivering babies. She did additional training as an HIV specialist. And now she has her own spot. Let me find out. Well, let us all know where we can find you.
All right. So I say this: if you're looking for a caring, a thorough, a passionate family physician, I am she. I'm located in the Mansfield, Texas area. The name of our practice is Livingspring Family Medical Center, and we are accepting patients. You can find us to make an appointment or find out more information about me, or even send me an email at www.livingspringmedicals.com. I'm also on Facebook at Livingspring Medicals, and also on Instagram at Dr. That's small d small r underscore Olabintan, Olabintan.
Wonderful, wonderful. Thank you, Dr. Olabintan. Like I said, I told you I was willing to share her with you. And because I am so generous, I will
Yes, you are.
continue to do so. All right. So you can find my friend, Dr. Olabintan, in the Mansfield, Texas area. That's a little bit outside of the Fort Worth. So all you Dallas, Fort Worth people, you know where you are going to find your doc. She is here for you. She has a wonderful office there, and she is here to take excellent care of you. Now, thank you, Dr. Olabintan, for stopping by. Thank you, thank you, thank you. Well, I'll let you guys know. Here at our Your Care Docs, we have a super special event on the 25th, 6th, 7th, and 28th of this month. We have our first virtual summit. It is the Empower and Inform, that's right, Women's Cancer Summit. So we have doctors from here in, well, actually here in Texas, right? In Houston, Texas, we have Dr. Abina Brewster. She is one of the top doc. She's an epidemiologist, a medical oncologist. That means that she's a medical doctor. And she's going to be talking about breast cancer. And she's going to be doing it live. So if you have all your questions, pile them up and jump on. And don't forget to sign up for this and register at our www.urcaringdocs.com. That's yourcaringdocs.com. So we have Dr. Brewster. We have Dr. Minako Abbey, and she's going to be joining us from Tokyo, Japan, and she's going to be talking about immunotherapy. Yes, Dr. Minako Abbey, you're going to have this wonderful, wonderful experience. And we have Dr. Mitra Ayazafar, who is going to talk to us about her experience when the doctor becomes the patient. Yes, you're going to see all of that on our virtual summit. And we have the wonderful Dr. Lorna Rodriguez. That's my Boricua sister. That's right. She's our MD PhD. And she's a gynecologist oncologist. So she's a gynecology oncology surgeon. So there aren't that many of them out there. So she takes care of all the women with gynecological cancers. So she's going to talk to us about ovarian cancer and why it's so hard to detect and the importance of making sure that you talk to your doctor, right? You do not want to miss all of this. And I'm pretty sure I'm going to have some extra special additional folks. We're going to drop all that info next week. So you do not want to miss this live event. And we have the virtual part of it, right? So just grab your favorite blanket, your favorite drink, your favorite snack, and just chillax and come out and be a part of this wonderful event. Sign up at www.yourcaringdocs.com. That's URCARINGDOCS.com. We all look forward to seeing you there. And like I said, if you are in the Mansfield area, Dr. Olabintan is the doc for you. We thank you all for watching and leaving a great comment. And if you are listening to this in a podcast, come on now, leave her a 5-star review. She's that good. She is hot stuff, right? Alrighty, I will see you guys next time. Thank you all for tuning in to our Your Care and Docs Who Care special with Dr. Olabintan. Take care. Bye-bye.
Bye.